I often get asked, what makes Nucca Chiropractic different than regular chiropractic? I'm Dr. Leah at Transcend Chiropractic. My husband, Dr. Connor Davis, and I own and operate Transcend Chiropractic, where we specialize in a chiropractic technique called Nucca. Now, Nucca is a branch of upper cervical. So upper cervical is a category of chiropractic. When you think of chiropractic, most people think of maybe the popping, twisting, cracking type of back popping chiropractic techniques. In general, that's a disservice to the chiropractic profession because there's a lot more to it than that. But upper cervical particularly is just the focus and specialty of the top bone of the neck. Orthogonal upper cervical techniques consider the top bone of the neck in relation to the skull and the rest of the spine. Now, Nucca specifically, what we specialize in is a very precise and detailed adjustment. So all of the steps that go through getting the alignment of the head and neck precise has been really well thought through. So the first step that we do is take a series of x-rays on a patient and be able to measure the relationship of the top bone of the neck with the skull and the spine below. We also measure the surface of the skull, how it sits on top of the atlas, which is the first bone of the neck, and then the surface below the atlas. And then understanding that person's particular biomechanics, we also measure the degree the top bone could be shifted from center, how much it could be tilted, how much it could be twisted, the direction the skull is leaning on top of that, or the direction the neck is leaning. With that whole analysis, no two people misalign the same. It's actually really unique. So therefore, the way that you adjust somebody is also unique to each person. No two people get adjusted the same. We use all of those measurements to calculate a specific adjusting angle to get the head and neck and the spine to realign in the best proper position it can be. So again, we start with those x-rays. Dr. Connor and myself, as the doctor, we analyze those x-rays, calculate the angle, and then we administer the adjustment based off of all of those measurements. After we adjust somebody the first time, we then take another set of x-rays to remeasure the head and neck. If the head and neck are not aligned properly, with the technique we practice, we're going to fine-tune the angle and adjust again until we get it right. So our patients aren't constantly coming in and out getting adjusted. We're getting it corrected at one visit. And that's just the difference in the corrective process that comes with practicing Nucca Chiropractic. So our patients are looking for long-term, lasting corrective results versus the therapy. A Nucca adjustment is also very gentle and precise. It doesn't feel like we're doing really anything when you're getting adjusted. You don't get the satisfaction of the pop, or there's no fear of a pop or a twist to the neck. It doesn't involve anything like that. It's a very corrective, fine-tuned process. I hope this video was helpful in explaining maybe some of the differences in upper cervical Nucca versus regular chiropractic. If you have questions or you are curious to learn more about if Nucca can help you, contact our office at 865-344-0955, and we would be happy to sit down and have a consultation and exam with you. Thank you.